Oh, great, thank you. And yeah, we listed a few of the endorsements there in the central thing. This is just the cover of the book.
So did Herman write that, Bob, before he passed away?
Yes, he did. Yeah.
I guess he obviously didn't write it after, but that's
Yeah. Yes. Otherwise, it would
that
have
was
been
a
really,
loss. He was a great guy.
yes, it was a great loss. How do I move? There we go. So, as I said, the point of this book was to create an integrated approach to well-being that includes psychological and physical and societal and the built and the natural environment. So it's very much putting all of these pieces together, not looking at them completely independently, I think, as they have more or less been looked at in the past. So we encouraged, what is that? All of our contributors. Okay, what is this? I don't have permission to access this application. Thank you. We encouraged all of contributors to try to cross the boundaries that they were originally writing in. I'll go quickly through what the table of contents looks like, just to give you a feel for some of the people and some of the topics that are included in the book. So we had some, as I said, psychological well-being chapters. And again, we wanted people to go outside of their comfort zone to the extent possible. So it's not completely just limited to psychological. Carol Bripp is a well-known proponent of eudaimonic well-being. We go beyond hedonism to a broader sense of well-being. And I won't go through this whole list, but you can see that there are quite some interesting chapters there. One of our colleagues, Bruce Chapman, talked about marital status and its effect on life satisfaction. It's a really interesting chapter there. And we had a chapter on Indigenous Australian understandings of holistic health and social and emotional well-being. And also, well-being in higher education. So you guys all might be interested in that. Interrupt me with questions at any point. The physical health and well-being chapters, as I said, Paul Dugdale is a medical doctor, Elizabeth Rieger is a psychologist. And how do we integrate? They worked on the whole obesity issue as a illustrative case study of how to integrate across these diverse perspectives. Well-being and personal safety, aging and well-being. I thought that was an interesting contribution. And also dying. That was an interesting chapter. So well-being in the experience of dying and dying well. On the societal well-being chapters, we had one on well-being frameworks. I'll talk a little bit more about that because I think that's an emerging issue that many of us here at IGP and UCL and elsewhere in the world have been working on. Julia Kim talked about the lessons from Bhutan's journey into well-being and gross national happiness, which you've probably heard about. So it's a really interesting case study and story there if you haven't heard about that. Carol Graham, who's one of our panelists later, wrote about America's crisis of despair. But I think she's going to be a little more positive in this panel discussion. And Richard Wilkinson and Kate Prickett, also our panelists, talk about inequality and the transition from GDP to well-being. And ultimately, we talked about an economy that's really centered on human and ecological well-being. Finally, we had chapters on the natural environment and well-being, starting with issues about natural capital and ecosystem services, weaving well-being into the fabric of the economy. Oh, I already did that one. Sorry. So on this well-being frameworks, I thought this was an interesting graph that Jackie Shearmer and Robert Tenton and John Goss put together, looking at all of the domains that go into existing well-being frameworks. And they pointed out that almost all of them include something about human health, something about standard of living, something about education, something about the environment. And most of them also include something about the built environment, employment, citizen participation, advantage and equality, governance, and institutions. And others, at least half of them, includes things about subjective well-being, social capital, economic performance, etc. So there's been a lot of work on these alternative indicators. In fact, and this one is the Bhutanese version, which has 9 domains and 33 indicators that they've been working on. And they actually do surveys of people in Bhutan and ask them, what is it, a 6-hour-long survey that go into enormous detail in all of these areas. So it's quite an interesting component. We actually did a class last term where we tried to identify all of the alternative indicators that we could find out there, and we came up with over 375 of them. In fact, this is probably part of the problem, that there are so many different ones that they're not really coming together. There's no real consensus about what should be in there, even though I think they all agree on quite a few things. So I think our goal going forward is going to be try to build this broader consensus. I think that's what this book is trying to get at. How do we get toward an integrated science of well-being, one that can really put all of these pieces together and say, what are the key components, and can we build a broader consensus about what goes into them? And also, can we build a movement along these lines? There's the Wellbeing Economy Alliance, which some of you may have heard of, which is trying to pull together all of the different groups and individuals and, in fact, governments that are working on becoming well-being economy governments. It's a good TED Talk from Nicholas Sturgeon. I encourage you to take a look at if you haven't seen this, about why we need governments that really are focused on creating well-being rather than simply maximizing GDP and economic activity. So I think there is a growing movement there. There's a few vanguard governments, including Scotland, Iceland, Finland, New Zealand, and Canada, that have joined this Wellbeing Economy Government initiative, and hopefully others will follow suit going forward. So with that as a brief introduction, I'm going to turn it over to Ida to introduce our panelists and to moderate some of this.
Thanks, Bob. Okay, I'm going to do quick intros, and panelists, if I've missed anything important, please add it. But basically, so I'm just going to start in order of which way they'll speak. I'll introduce all of you now so that I don't interrupt in the middle. Kate Pickett is OBE, Order of the British Empire. I think I got that right. I think so. As a professor of epidemiology at the University of York, she co-authored with Richard Wilkinson, The Spirit Level, about 2010, and then a few years later, The Inner Level, and they both co-founded the Equality Trust. Richard Wilkinson is a professor emeritus of social epidemiology. Sorry, that's one of those words I have a hard time with, at the University of Nottingham. He is also an honorary professor at UCL and a visiting professor at University of York. Carol Graham is a senior fellow at the Brookings Institute and a professor at College Park in University of Maryland. Research fellow at the Institute for the Study of Labor, and the author of numerous books, papers, and edited chapters. You'll notice that I'm introducing Jackie McGlade, who is not actually here at the moment. She will join within the next 10 minutes. She has a UN thing that she's part of, so she's just running a bit late. So she did warn us, but she is a professor at University College London here at IGP, and she's also part of the Faculty of Engineering. She is also professor at Strathmore University in Kenya, chief scientist at a company called Downforce Technologies. Previously, she was the chief scientist at the UN Environment Program, and before that, director of the European Environmental Institute. So let's welcome our panel, and Kate will start first. So I will stop sharing this, maybe. And Kate, you should be able to share.
Thank you, Ida. Thank you for that introduction. Sorry that our profession, our discipline is so difficult to pronounce. You're not the only one that has trouble with that. All right, let's see if I can't share my screen because it says that I'm not able to.
Okay, and I will try to solve that problem by making you a co-host
Okay.
I guess you'll need to do that for me too.
and make
Carol.
co-host. And Carol, so you're not left out. And I know you don't have slides, but I'm still gonna do it. So, okay.
I'm honored.
Kate, you should be good now. Oh, yes.
Okay, can you see that, everybody?
Yes.
Great. Yes, thanks for the introduction to the book, Bob, and the introduction to us, Ida, and thank you for giving us an opportunity to be part of the book. And I'm glad you mentioned those data about marriage, because Richard and I are married. So although we're appearing on different screens, we are actually in the same house. And we were discussing those statistics today, actually, and remembering that marriage is very good for men and less good for women's well-being. But he's the beneficiary of that in our
marriage
household.
is an exception to that. It's good for Kate.
Yeah, I'm
as
definitely
well.
an exception to that. But Bob talked about this book as being a very multidisciplinary, interdisciplinary, transdisciplinary book. So perhaps, you know, it's a bit surprising that you're going to hear from one epidemiologist after another, but we will try and cover slightly different material. Richard and I are both social epidemiologists, and epidemiologists are, of course, interested in studying the differences between populations in terms of their health and well-being and the determinants of those differences. And I want to offer up some thoughts for our later discussion. And one is about whether or not we might prefer objective or subjective measures of well-being when we're trying to think about the health and well-being of populations. And the reason I think that we have been very alive to the possibility that when you measure subjective well-being, you're getting at something somewhat different than if you're measuring well-being through objective measures, I think was first sparked by this table, which come from colleagues of ours, Danny Dorling and Anna Barford, who were looking at the differences in the prevalence of self-rated health and life expectancy in various countries. And they're looking at some OECD countries here. And what they had found, somewhat to their surprise, was that those statistics don't marry up very well. So at the top of that table, we have Japan, which has the highest life expectancy in the world, according to WHO figures. It still does, even though these data are somewhat old. And you can see that in Japan, on this table, life expectancy in years is 82, but only 54% of the population say that their health is good. At the bottom of that table, we have countries like the USA, where life expectancy is much lower, but a much higher proportion of the population say that their health is good. We could later in discussion perhaps go into some of the reasons why a self-rated measure might be showing something quite different to what an objective measure shows. But this is an area where we ought to be debating what is the important thing that we're measuring? What do we most want to improve? And if different measures are telling us different things, what do we do with that information? Now, in public health, we do have a couple of indicators, I think, that we have always thought of very much as strong indicators of the health of a population, and indicators that actually are quite responsive to changing circumstances in the changing environment. The infant mortality rate is one of those, and we do think of that very much as a canary in the coal mine. It can respond quite quickly to changing circumstances. It can tell us an awful lot about the health of a population, and it's measured surprisingly well and comparably across different countries. I just want to share some data with you on what's been happening to the ranking of the UK in terms of its infant mortality rate over time. We're going to start in 1960. So we're looking at rich countries here, OECD data. And in 1960, the UK ranked 6th for its infant mortality rate. So only 5 countries were doing better than us. You know, we probably should have been feeling quite proud of ourselves for that. 10 years later, we had dropped to 8th place in 1970. By 1980, we were down to 9th place. Another decade later, by 1990, we're in 10th place, and 9 countries are doing better than us. By 2000, we were coming 15th. By 2010, we're in 18th place. And in 2020, we've fallen to a shocking 21st place. Now, if you had been paying attention as a government or policymaker to our ranking in those international sort of league tables of infant mortality, you might have started thinking you needed to do something to act on the causes of declining well-being just by looking at that single statistic. And in fact, that single statistic can even tell us about the impact of austerity on the health and well-being of the UK in the last decade. Around the time that austerity was imposed, we started to sort of not only just see a slowing down of improvement in the infant mortality rate, we started to see a rise in it, completely unprecedented in modern times, starting for the most deprived, that's the line at the top, but actually ending up affecting everybody. So a rise in the infant mortality rate since 2010 through that decade of austerity. And if we look at life expectancy as well, I like this figure because it came from the Daily Mail. They don't always do our scientists a great service, but here they put out an infographic showing that life expectancy had ground to a halt since 2010 for both men and women. First, we saw a slowing down of the life expectancy improvements that had been happening over the sort of past century, and then we actually started to see a decline. So if you'd paid attention to just 1 or 2 objective measures of health, you would have been able to take action to protect and promote the well-being, the health of the population without needing particularly to think about subjective measures, complex measures, indicators, extra data collection. Those simple statistics would probably have been enough to enable you to act, should you have wanted to. And if we think about the causes of health and well-being in populations, Richard and I, along with all other social epidemiologists and most public health workers, you know, in across the world, work within a framework of the social determinants of health, where we've spent time over decades, you know, trying to understand the factors that produce differences in the health of individuals and differences in the health of populations. And, you know, we feel actually a lot of the time what we need to be paying attention to are the structural determinants of health and the variations in health across populations. And again, over recent decades, we've had academics paying a lot of attention to those things, and we have had a series of reports on health inequalities in the UK, starting with the Black Report, which was published in 1980, which was instigated in response to a letter that Richard wrote to the then Secretary of State, followed by a report in 1992, the Aitchison Report, followed by the Marmot Review in 2010, and we've had an update of that 10 years on in 2020. All of these reports called attention to the inequalities in things like the infant mortality rate, like life expectancy, and set out solutions for those. But the inequalities are just as large today as they were in 1980, and action on those structural determinants has not taken place systematically or been able to address those underlying structural causes and therefore change the picture that we see in the population. I think we've also come to a point now where we understand, perhaps more than we used to, about the ways in which what we think of as the vertical inequalities that cut across whole societies from top to bottom. So inequalities in income, inequalities in wealth, inequalities in power or education and skills, how those interact with and intersect with inequalities that are associated with belonging to different groups, whether it's women versus men or race ethnicity groups, identified by their disability, their religious affiliation, or their language, and also with geographical inequalities in access to services, for example, or socioeconomic opportunities, and how those entrenched and intersecting inequalities affect well-being and the quality of life. So I think from my perspective, and Richard will give you his in a moment, we know how to measure the aspects of well-being that probably are enough to tell us what we need to do to act on it. And we understand more than we used to about the social and structural causes of those differences in well-being, but somehow still that doesn't make it necessarily easier for us to act. I'm going to go from this fairly complex chart to end on a very simple one to lead into what Richard's going to say. And this is a graph that he often shows and says it represents his entire life's work in one simple slide. We work
for me to say that, but not for you.
we work on the relationship between income inequality and well-being. And so I'll stop now and pass over to him, and I'll stop sharing my screen.
Thank you, Kate. So let me share. Okay, I think you can see my screen. This is the graph that Kate just showed you, but filled out for some different problems. It's the one we produced years ago in our spirit level. And really, in a way, what it shows is it's not just health that Kate has been talking about, but a host of other social problems that go with inequality in much the same way as we found then that health does. And Kate showed you that our declining position in the infant mortality league table. She could have shown the declining position of the USA in life expectancy. You know, it's one of the poorest life expectancy records amongst the rich countries. And in both cases, that rather parallels the way inequality, income inequality, has been increasing faster in those two countries than in most of the others in this graph. Here, what you're seeing basically is that all these things listed on the left get worse together with greater inequality. They're all weighted equally. But as Kate mentioned, child well-being, infant mortality rates. This is the UNICEF measure of child well-being. It only slopes down because here poor scores count low, whereas in the last one, poor scores counted high. So basically, you're seeing exactly the same pattern, which in a way shows, I think, that inequality has a very broad effect on well-being. We had no hand in compiling the UNICEF Index of Child Well-being. It contains I think about 40 different variables, everything from whether kids feel they can talk to parents, to whether there's bullying in schools, whether they have books at home, what immunization rates are like, all goes into it. I want, though, to concentrate on what we mean by inequality, or rather how inequality has these disturbing effects. I think most people regard inequality in rather simple material terms. You know, the rich have lots of everything and the poor have very little of everything, as if the outcomes that I'm showing you are simply the result, the direct effects of poor material circumstances. But they're much more the effect of what our material circumstances do, our relative material circumstances do to our social relationships. I often argue that we should think of inequality as a social relationship, in that it puts us in a sort of hierarchy from dominant to subordinate, from superior to inferior. And it structures our relationships in those terms, so making class and status differences more pronounced. As those class and status differences become more important, with bigger material differences between us, we all worry more about how we are seen and judged. You know, do people think you're successful and look up to you, or do they look down on you? Do you feel disrespected? All that kind of thing. And so think of inequality not simply in material terms, but in psychosocial terms, to do with the whole structure of social relationships, particularly around status and class in our society. And basically, as inequality increases, it moves our society away from the relationships of reciprocity and cooperation that you get in more equal societies towards relationships, as I said, of dominance and subordination. I was touched, actually, that Bob and Ida invited me to take part in this, because I think I'd played the role of, well, I can hardly say an enfant terrible in the book, but a vieux terrible by being controversial and asking awkward questions. And the things that I think concerned me, and which I wanted to put into this important discussion of well-being, were really, and as we think about trying to switch our societies away from economic growth towards maximizing well-being, I have real worries that our governments could decide not to pursue economic growth, but that wouldn't mean economic growth would stop. You know, we live in societies where everyone wants a bigger income and every company wants to sell more and increase its profits. And I do worry about whether those pressures would go on driving economic growth even when governments were no longer pursuing it. So I think there's an important issue of whether we have to go much deeper into the structure of our society and market capitalism to move away from those sorts of objectives. But I also think that the main reasons why our governments don't pursue well-being as much as we'd want them to are political, not because we don't understand well-being. I think that if our governments really wanted to improve well-being, we know so much about the social determinants of health, as Kate said, but we also know the damaging effects of poverty and homelessness, unemployment, food insecurity, and as we've been seeing over the last 10 years, the damage caused by the inadequacy of public services, particularly care services. So I do see our major obstacles as political and ones that go deeply into the structure of market economies, making us always want to do better, which I think Kate and I see rather as being driven by status seeking. why we want so much more than we need is to look better in other people's eyes, to improve our social position. And of course, although we can improve our well-being in society by moving up the social scale, if you make the whole society richer, as economic growth is meant to do, that doesn't change average social status. It's a zero-sum game. And in a way, that's rather like the Easterlian paradox over well-being. So I say I am touched to have been included in this, despite my role of rather running counter to some of the important trends and issues discussed in this book. I also, the last point, worry that now people are talking about maybe we're going to 3 degrees warming, whether it's realistic to think about improved well-being, or whether we're going to be so swamped with endless environmental problems, food shortages, huge flows of refugees. But even then, I think greater equality has an extraordinarily important part to play. We've seen in the Guardian newspaper recently things about the enormous role that the rich have, with a huge, much bigger carbon footprint than the rest of the population. But if we're going to face real upset, constant crises, environmental crises, mutual support is absolutely crucial. And that is assisted by greater inequality, by greater equality. So I'll stop there. Thank you.
Thank you, Richard. Carol, you're up. Let me do this. Can I do this? No. Carol, can you hear me?
I can hear you.
Great.
I just don't know. Do you want me to, are you ready for me to start?
Yes, go for it.
Okay. All right. Well, I want to echo some of the themes in Kate and Richard's. It's kind of a back-to-back presentation, but a lot of similarities running through it, and agree with many of them, and maybe beg to differ on another, which maybe I'm being the enfant or the vieux terrible in the room today. But on the agreement, I think what you talked about in terms of the kind of the effects that inequality has on society as a whole are really well written about in a book that Bob Putnam wrote about 10 years ago called Our Kids. And what really struck me is how he described going back to the neighborhood where he grew up, and before we had become in the US, which is the poster child for high levels of inequality, big, huge health gaps. And if you noticed on the chart, the last chart that Richard showed, the worst on child well-being outcomes. If you all are in bad shape, we're falling apart at the seams. So I don't know if that makes you feel better or worse. But anyway, he said that what inequality had done was really erode social fabric. And so just a very simple example, it used to be in his neighborhood that rich kids and poor kids all went to the public school, and they all played sports together, and there was a cohesion to that, and their lives weren't separated by their income levels. But over time, and as inequality has increased, and then particularly top-driven inequality, so driven by very high levels of income among the rich compared to everybody else, what you've now gotten is that the rich kids in the same place go to private schools, they play on, sports teams, travel soccer teams, travel whatever, any kind of team. They have different club sports, they go to different schools, they have different, the nature of the parties they have or socialize, how they socialize reflects just huge differences in incomes. Now that's a very simple analogy for, I think, what is a very big problem. But I just agree that there's more to inequality than just income at stake. And I'm going to talk a little bit about how inequality has spilled into our health system and life expectancy and all sorts of other things. The second point about inequality, where I agree with Kate and Richard, is that income inequality tends to be well-being reducing unless you are moving up or, you know, moving ahead. And at least in the US, social mobility has decreased dramatically. And again, the gaps between the very rich and everybody else are bigger and bigger. And it isn't just in health, which I'll talk a bit about, but in education opportunities, in all neighborhoods. What, you know, even in public schools in wealthy places, like around DC where I am, they're some of the best public schools in the United States. And that's driven by, you know, concentrations of very, no, I wouldn't say super wealthy, but wealthy parents who then can afford to support the schools. But they make the neighborhoods, that drives up property rights or property values, and they make the neighborhoods unaffordable to everybody else. And there's all sorts of other ways in which income inequality is well-being reducing, and it shows up in the data that if, for example, if you take two people with the same average income and one lives in a wealthier neighborhood where the median income is higher than theirs, and another lives in a poorer neighborhood, but their income is closer to the average, it's the person who lives in the wealthier neighborhood who reports lower levels of well-being. Again, because there's sort of a, whether it's an envy effect or whether it's a left behind effect or whatever it might be. In contrast, when people have higher levels of well-being, there are positive social externalities, right? That people in better health tend to be happier and healthier, and that spills over into neighborhoods and all sorts of other things. And then the one point of disagreement is on, and I'm not sure it's really a disagreement, maybe it's more of a nuance, but I, for one, am certainly not one that agrees with throwing out GNP and only having well-being as sort of the objective of government policy. I think it should be an objective. I think what the UK is doing in terms of trying to include the metrics in their statistics, in cost-benefit analysis, in budgeting analysis, New Zealand in a similar way, while still sort of keeping track of both sets of indicators, is probably, I think that's a much better approach. And I actually think that the subjective well-being metrics contribute the most when there are gaps between what the official statistics say and what subjective statistics based on subjective well-being say, as in the case of Japan. And the US is another one, sort of where huge gaps and unfortunately unreported gaps, because we don't track well-being metrics in official statistics, despite my trying for years and years to get that to happen. So for example, prior to COVID, let's sort of for now leave COVID out of this, because this is a decade-long trend. You had record, quote unquote, record unemployment rates, booming stock markets, you know, Donald Trump boasting about how great his economy was, and, you know, markets also quite, you know, positive and all sorts of things. And yet you had almost 20% of prime age males out of the labor force, meaning they've dropped out, right? So permanently dropped out. If, at least in the calculation of unemployment in the US, if you haven't been looking for a job in the past 6 months, you just drop out of the ratio. So our unemployment ratio, the official one, looks really good. And yet we have a huge percentage or proportion of the prime age population that's out of, just completely dropped out. And those people tend to also be in deindustrialized places. They have fallen behind, at least in status, if not in more ways, which is usually the case. High levels of addiction, poor health, and also just sort of high levels of despair. And they're very likely to be in the category of what we call deaths of despair, which I'm going to talk more about in detail. So here's a case where the official metrics completely mask a lot of things that are happening and eroding our health, social cohesion, and all sorts of other things. And it turns out that the prime age males out of the labor force in despair are much more likely to be radicalized and vulnerable to misinformation and other things than many other groups. They tend to live in, again, deindustrialized places, which have lost access to local news. which have lost jobs, and the communities that used to surround those jobs have also declined. So there's a whole phenomenon of kind of the haves and have-nots, but in very big ways. And what that really shows up in is our mortality crisis due to preventable deaths. We call them Angus and Ann and Case and Angus Deaton, sort of labeled these deaths of despair because it's suicide, alcohol poisoning, and the biggest problem right now is overdoses, drug overdoses. And it began, the big numbers began in the declining white working class. It's now spread in part due to fentanyl, in part, I think, due to the fact that even minorities now who for a while were making gradual progress to catch up also are facing more and more barriers to doing so. And one reason I, again, sort of emphasize the importance of both sets of metrics is that I've done a lot of work trying to track the trends and patterns in deaths of despair with metrics of well-being. And so I find that lack of hope, which is by definition despair, is the most important metric, more than reported pain, certainly more than just plain life satisfaction, but it's sort of your attitudes about the future, your hope for the future. More important than sadness, yesterday, all sorts of other metrics which matter, but the idea that your life satisfaction may be okay today, but you don't have any expectations for the future, is most associated with the people and places that have high levels of deaths of despair. And we also have done a little bit, not enough because of limited data, but a little bit of longitudinal analysis. And we find that the despair, typically the rise in despair, which we can measure via Gallup data in the US, which is quite refined, the rise in despair in these places and among these people increased often 3 to 4 years before the deaths sort of rose. And so I've thought a lot about the idea that these metrics can help, identify vulnerabilities. They can, by showing that things that are very different from what the objective trends tell us, they can be warning signs. I don't want to say predictive. I think that's too strong a word. I come from the dismal science where everybody tries to predict everything and they're usually wrong. So, but I think they certainly can be warning indicators of vulnerability. And so anyway, and the one thing that we now have, in addition to a crisis of premature mortality in the States and declining life expectancy, is a huge gap in those trends between haves and have-nots. So people, Ann and Angus just wrote a paper on mortality rates divided by people above, who have college degrees or not, and the trends are starkly different. And it is the have-nots who also lead worse lives, have worse jobs, have very little access to health insurance, which no other rich country has. They are literally dying in spades. And so you have just a gap. If you look at the trends over the past decade and what is happening to people with and without a BA, people with a BA have continued to improve in terms of longevity, health, whatever. And it's those without a BA, which is about 2/3 of adults in the US, are declining on many, many dimensions, and certainly due to these deaths of despair. So I probably talked too long. I do applaud Ida, Bob, and the other co-editors for a wonderful book, and also was pleased to be included. And I'll stop there. Obviously happy to take questions after.
And we have Jackie next. Jackie, I've already introduced everybody before the panel started, so you've been introduced. Do you have slides, or are you just going to speak? Okay.
No, I'd like just to speak. So fantastic. And my apologies for being offline, but now I'm back online. So great to be here. So first of all, what I wanted to say is I come from the natural sciences, and I have to stress that because I come with a kind of particular perspective when I find myself reading a book which is all about things that I don't know about. So that's always really good. So I have a book which from beginning to end tells me many, many different aspects of well-being, which, to be quite honest, I've encountered now more and more through the research that I'm doing here in Kenya and in other parts as well, to do with Indigenous peoples and to do with communities. And I wanted to sort of pick that up because having spent quite some time now, 5 or 6 years with communities, looking at not only perceptions of what aging is, what healthy life is, what well-being. Well-being is an interesting construct because the first thing you need to do is, of course, find the linguistic phrase that captures what is well-being. And surprisingly, you can have two tribes literally sitting next to each other in the sort of landscape, and they will have an entirely different word and a different view of what well-being is. And I think you fail if you don't recognize that context matters. So to simply say, you know, all Kenyans living in rural areas are the same is a complete nonsense. But what makes the difference is how the integral, and that's why I like this issue that you bring up later about having all the separate indicators, having all the separate frameworks, but how do you integrate them? How do you actually bring them together without making it literally a basket that you somehow do something normative with? And I think for me, the answer is, and I get this all the way through the book, which is you basically have to talk to people. You have to construct a world which is based out of reality rather than one which has got some, I would say, theoretical metrics, which you then try to put on top of the populations that you're looking at. So the conclusion I have again and again and again is that if you ask people in a considered way and in a deliberative way what it is that they see within the concepts of well-being, you pretty much cover the piece. It is an environment. It is all of those other kind of social constructs. It has sometimes to do with obviously access to education, access to the things that matter about health care. Can I get medication? Do I have mobility? And so on. But it's also very, very clear that well-being changes through life. So that when we look at, for example, older people in populations, they do have a very, very different perception. And that then gets translated into metrics that, you know, whether your body is functioning and the body parts are all functioning, in a sense, it's taken for granted that it may not be, but your health condition has, in many of the tribes we've looked at, got as much to do with your social connectivity, your social well-being, how networked you are, and so forth. So what I was sort of struggling with a little bit from my own perspective is it would seem that the well-being construct, which takes us all the way through psychological well-being, you know, through aging and so on, how we don't capture properly, and the book starts to do this, perceptions on pretty much everything, whether it's the environment, whether it's education, whether it's power of voice, whether it's literally, you know, art and creativity and sort of what is beauty and so forth, how those actually change through someone's lifetime and through a community's lifetime. And I think that for me is the sort of where this publication, this book, starts to really open up that we don't really have a one human picture. We have a journey where the perceptions and therefore the metrics that we look at for well-being need to also change. So whether it's through cohort studies or whether it's, you know, literally looking at Indigenous peoples from a particular perspective, I think that's really where I'm really struck at this different perspective here. You know, so it might be that we're talking about, you know, I think there was a chapter, I can't remember the top of my head, so I think it was Michael Chapman wrote about experiences of dying well. And in Indigenous peoples, dying well is just, it's almost a given that you do actually have that construct embedded as part of your cultural background. It's not anathema, it's not some sudden juddering halt. You work your way all the way through life, and that's just an expected part of it. And that is just life, ironically, at the end of it. So what I'm feeling very much, having sort of got my way all the way through it, I've been reading this for quite some time now, in and out, all through the day, and yesterday and the weekend and last week when I got it, is I felt I was on a journey in the book. And I really like that journey, that there's not just one series which you can apply to everybody in every place. So I'm going to leave it at that, but I want to leave you with those three thoughts that my research brings, I think, to a head the idea that there's a lifetime of well-being that changes. The metrics should probably change, that it's very contextually driven, but that there are some commonalities, and they come out as a clean environment, a healthy environment, access to education, power of voice, all of these big pieces. But at the end of the day, they need to be measured according to the social constructs that are there. Are you well embedded in networks? Do you have a say in how your network is going to evolve and respond to decision making and so forth? So yeah, I think I'll leave it at that, but it's social capital, well-being through life, and we shouldn't think of it as a set of metrics that just stay static. They actually have to evolve as you go through population, as you try to measure it. Not easy for a statistician, though, I would say. So let me give it back to the room. Thank you.
Okay, thanks. So now the plan is to do Q&A. I know we're ending in half an hour and Carol has a hard end in half an hour, but let's do some Q&A. So I got Bob's computer on so he can turn on his camera. And then we'll use the room mic so that it can go around, but so that you guys can see who's asking the question, we will pass around the computer as well. So yeah, there's one back there. Here, I got it. Yep, okay.
Oh, it makes me feel dizzy when you do that, Ida. Ah, being on a ship.
Very interesting presentations. Thank you very much. First of all, I'm going to ask an unreasonable question, but I'll ask it all the same, particularly in the context of some of the things we were saying about the decline in the US and the UK. What do you see as the way forward? What do you see as some of the solutions that we could apply? Maybe some of the solutions that indigenous communities perhaps could teach us from some of the experiences that you've had. What do you see as the way forward in terms of addressing some of these issues? I know that's a difficult question, but I'll ask it, as I said.
Thank you.
Who wants to take that one?
I was actually supposed to talk a little bit about that, so I'm happy to take that one on, or at least to start. And others can obviously chip in, but
Yeah, I'll jump in at the end on indigenous. Yeah.
yeah. So in the US, there's a really interesting puzzle. Although the more I've studied it, the less it's a puzzle. But minorities are much more optimistic and much less likely to be in the deaths of despair category than are whites. And I think that is because blue collar whites have had sort of declining status, and because minorities have been gradually catching up, there is sort of a sense of upward versus downward mobility affecting your perceptions. But I think deeper and more important than that is the community structures and spirit that minorities have that whites don't. So at least in the US, it's much more the kind of American dream myth, which really is a myth, unfortunately now, was that if you work hard, you get ahead. If you fall behind, it's your fault. If you're poor, it's your fault, right? You didn't try hard enough. It's a very individualistic work ethic. There's a big emphasis on the two parents, two kids, very, the immediate family, nuclear family, a lot of moving around. So you aren't as geographically connected with the rest of your community family. And that worked fine when there were these, very good manufacturing jobs and communities around those jobs. And for whites, it worked particularly well because they had privileged access to those jobs because of discrimination. And meanwhile, minorities had to stick together. They formed what I call communities of empathy, because even if some of them were getting ahead, they all, everybody had somebody who fell behind. And there is just sort of a sense of community that's so much stronger. It doesn't look like it, but I was born in Peru and actually have spent half my life in Latin America. And what I've always noticed the difference, and I remember I grew up between the two, and I loved my schools in the US, but I really always hated to leave Peru because it was just a very different sense of who your community was, and everybody was your aunt or uncle, even if they weren't related to you. And those communities have served, and African Americans have similar communities of support. The Baptist Church, for example, tends to be, it isn't about religion. It's not like evangelicals, which are all about your individual relationship with God. It's really about community more than actual formal religion. And that has served them well. And so what your point about what can we learn from indigenous peoples, or in the case of my research, from minorities, it's how do you involve communities in restoring community well-being? You need to involve communities. You can't come in with helicopter solutions. When there are mental health problems, you can't sort of send in a psychiatrist and think they're going to figure out who's in despair. And it is there's a lot of movement on including communities in those efforts. A great source of a lot of that information is at the UK's What Works Wellbeing Centre, directed by Nancy Hay, which does all kinds of designing and evaluating interventions to improve well-being, whether it's reduce loneliness, whether it's reduce isolation among the elderly, or teaching socio-emotional skills in schools and evaluating those efforts. They tend to be among if anything stands out, it's that you involve the community and you get isolated people to be involved in their communities, and the effects are lasting. Obviously, young generations and old generations need different solutions. I mean, young generations still need to train with skills so they can participate in tomorrow's labor markets. Some of them are socio-emotional skills, which most schools don't teach. Older people tend to benefit just from getting involved in their community. They're not trying to forge a career in the future. So you have to think differently about different population cohorts, but there's a lot of momentum and much more disconnected, isolated experiments in the US, but it's also very, it's really becoming an objective of at least efforts to increase well-being and reduce mental health problems, to think about not just individuals, which of course you need to think about, but communities as a whole. And I think there's a very clear lesson from, in our case, minorities, but I think also the things Jackie was talking about how different communities had different conceptions of well-being, and how they themselves define, what is well-being in their community.
Kate,
Yeah, if I could go next, Jackie, and then perhaps you've got much more wisdom than any of us here to share about Indigenous communities. I thought the question was really challenging because actually it was asked as what can we do, and it wasn't clear to me actually who is the we are talking about when we think about what can we do. Is that we as academics or as researchers? Is it we as citizens and as a society? And I think we do need to think about the different levels at which things operate. I mean, a lot of the statistics that I was showing at the very, very beginning are things that have been happening in the UK because of the government we have had for the past decade. So one of the answers to what we can we do would be, let's change that government. And that kind of shift needs to happen at multiple layers. Since Richard and I have been working and sort of presenting and traveling around together and drawing attention to the impact of inequality, we have seen much more attention paid to that at the level of international organizations, such as the OECD, such as the UN, different bodies. And at the moment, recently we were asked by Oxfam to help them think about how can the World Bank set thresholds for how much inequality is too much. And we've seen quite amazing, wonderful action sometimes at the level of local authorities with local government within the UK, or devolved governments, Scotland and Wales doing things differently, or regional government that we haven't seen at national government. So the answer to the question of what we can do at that level would be to have a change. And I think the other important thing I wanted to raise in response to that question is that we must avoid the temptation to try and mitigate against the effects of poverty and inequality and deprivation and destitution by trying to get people to change their behaviors or trying to fix individual things. Communities are important, and we must do things at the community level, and we must try and address where people are at with the despair in their lives. But we must not forget that the best answers to some of these problems are deeply structural, transformative changes that need to happen at a level that we can work towards and we can help promote, but that they won't just happen because we produce some statistics to say that these are problematic.
Okay, thanks.
Jackie wanted to say something.
Jackie?
Just very quickly. So the we, if I think about Essex, I'm now going to make a connection between Essex and Kenya. Oh my God. So Essex, I've spent the last 2 or 3 years working there, and talk about areas of destitution. It's just horrible. There are people who literally over 6, 7 generations have never had a job. It's soul despairing. And then suddenly the county council decides it's going to set up a climate commission 2, 3 years ago. And who would have thought this climate commission would have touched pretty much every single person in Essex? Not about climate, about everything else than climate. Green spaces, jobs, the kind of food that people have access to, transport systems, education. And I've been completely amazed at how, coming in from a government, a government topic, a county like Essex was able to grasp it at the grassroots level to the point where people are crowdfunding the restoration of their landscapes literally in their local areas, because they suddenly feel that they can have some say over their environment that will help their well-being. And they have in their mind, somehow, I need to be within 5 minutes of a green space. And that's transformed the whole transaction around what people do with the little bit of money that they have. And then what has stimulated for me this incredible community idea is that in Kenya, of course, it's written in law. Everything is written through communities being responsible, not only for budgets politically, but also for living and literally making sure those corridors of consumption don't squeeze people out. So you don't have people with too little, and you don't have too many people with too much. But what has come out of that is an entire informal economy of young people, 16 million people who have signed up and are part of Shujaz, which is literally, let's get working, let's get going. No formal education, but using social media. And now they have connected to the young people in Essex to create a similar movement with things like hustler MBAs and all these different ways of proving yourself able to take on work. So communities don't have to only be restricted to the physical and where you live. You can create these convivial communities across the world. It's just finding the common pieces that put them together. So I'm going to answer the question of what can we do. Sometimes I think you need to look up and out as well as look down and in and find those new connections between communities that will actually stimulate a whole different reasonable response to very, very difficult circumstances in which people live.
Thanks.
Okay, thanks.
Other questions? Wow, quiet room. No? Okay, we might, oh, there's one. Oh, it's coming. Trying not to make you guys can see. I'll turn on the camera on here.
Hello, everyone, and many thanks, Kai. Many thanks for your very inspiring presentations and the wonderful book. I must have to buy this. I totally agree with Kate and also partially Jackie's opinion about these deeply embedded structural issues related to well-being. So I come from a different background. So I come from construction. So construction, the industry, has the highest number of the rate of suicide rate. So as a researcher, so we do a lot of research and to understand the structural conditions, the management conditions, organization conditions, all those things to understand why this happens in terms of well-being condition of the workers, as well as including the health and safety of the workers as well. So we roughly have a good understanding of why this happens and how we possibly can change this to transform the industry, for example. But this condition has always been there. So for over the years, regardless of which government this is. And on the other hand, the business kept coming to us to ask us to design, say, employee well-being strategies or initiatives. So as a researcher, I kind of quite feel powerless of facing those issues. So I want to ask the panel, so how as an academy we can deal with this issue? So yes, it's not at the national level, it's specific to an industry or to the business sector. So how we can deal with employee well-being in the UK context. Thank you.
Richard, do you want to talk about the importance of unions?
Well, in terms of inequality, I think that you can look at the past and see what has driven major changes in inequality in the past, and we are talking about very major changes, not the sort of thing that can be made, changes that can be made in a year or two. And the picture during, for instance, the 20th century was that from sometime around 1930s, inequality started to come down, and it went on coming down until about the end of the 1970s, and then you get the huge modern rise of inequality. But if you look at the proportion of the population in trade unions, proportion of the workforce in trade unions, it does almost exactly the opposite. So as inequality comes down and then rises again, proportion of the population in trade unions does exactly the opposite. And you can see this pattern in one country after another. It's not specific to one country. I've seen it for at least half a dozen countries, and it's extraordinarily close. And what I think it tells you is not simply that trade unions transform wages. I don't think they do all that much, but it's the importance of a countervailing voice in society, people having another idea of how society can work, and structures which temper the desire for more from people at the top. It looks as if high top tax rates actually make people at the top think that it's not worth trying to get much, much more. But my hopes, I think, are not that we'll be able to recreate a movement like the social democratic movement, the labor movement of the past, but that we'll have to do something about inequality in order to move towards sustainability. The data that's been coming out from one study after another suggests that you're not going to get most of the population being willing to reduce their carbon footprint or anything else unless it's accompanied by policies they think are fair. You're not going to, and the latest data, I think, if I remember it right, it says the richest 1%, their carbon footprint is equal to the 66% of the poorest in each country. An absolutely astonishing figure. And although there's stuff about trade unions and the strength of the labor movement and so on, it tells us that only very major sustained political movements can make much difference. I think that if we're going to ever reach sustainability, we have to combine it with reducing inequality like that. I did want actually to make one point in relation to what the first question, and that is, I think we must obviously do more than recognize that different cultures have different ideas of well-being, but could go on the next step and ask why. And I would have thought so often an important part of why is what aspects of well-being are important. There's quite a funny little video on the web somewhere of an anthropologist interviewing some modern hunters and gatherers. And the anthropologist is trying to get a sort of philosophical view out of these people of what they think the meaning of life, what is life all about, out of them. And all he can get from them is they say meat. Meat is the important thing. We emphasize the quality of social relations because they're pretty poor in our modern societies. In other societies, material things are more important. So we must follow up and try and see whether there's I don't like to say a hierarchy of needs, but to see more about what it is about a culture, a society, people's living conditions, which means they emphasize that there and that there.
Hey,
Can I
thanks,
add to that? Can I just add really quickly to Richard's last point, which is, I agree with you, Richard, and people in different contexts have emphasized some things more than the others. But I think when we find using consistent metrics, that around the world, people still value a lot of the same things. They value health a lot, as you know, more than anybody else. Income matters when you need it. More and more income does not make you more and more, satisfied with your life. Enough income certainly allows you to choose the kind of life you want to lead and not have to sort of do anything because that's your only choice. But things like social relationships, family, community ties matter a lot to people everywhere. We're sort of short on all that in rich countries, but it doesn't mean it doesn't matter to people. And I think increasingly the data shows that it does, and those things are missing. So I agree, we have to think about different contexts differently, but I think there's more similarity across poor and rich populations than you would think.
But what I meant, Carol, is that social relations matter to us because we're so often without them, or with difficult social relations. Matters to us because we're not replete with wonderful community lives.
okay, thanks. I think we're going to wrap it up there. Maybe just to say a few closing arguments, and just to follow up on what Carol was saying. I mean, I think there is the concept of limiting factors. I mean, I think there are a basic set of human needs that are shared across cultures, but they are available in different combinations at different places, different times. And yeah, if you're out of meat, that's the big thing. You have poor social relations relative to other inputs. So I think getting toward an integrated science of well-being is understanding what are the similarities across people everywhere, across cultures, and what are the differences, and how do they manifest themselves. So we very much want to emphasize the first word in our title, which was toward. The fact that we're certainly not there. We are, as we've heard, I think, that there's a long way to go to get to this sort of broader understanding of what actually does contribute to well-being in different times and places and cultures, and all of the components of that. Our panelists didn't really mention the natural environment very much, but that's certainly a big contributor to well-being that we often don't think about, just because it's like water to a fish. So but I think it is extremely important. And I think our emphasis in the book, as we tried to do, is to say it's complicated, and all of these things matter in one way or another. So it's very much an exercise in and rather than or. But how do they all matter? How do we put it all together? That was our goal in this initial attempt, anyway, to move toward that integrated science that I think is something that we need. And just to respond to Richard and his comment, I think the problem was that we actually agreed with what he was saying. He wouldn't accept the fact that we were agreeing and tried to argue that no, you must disagree with this. No, we didn't really disagree. But anyway, because I think it's all important. And one final point is that I think to actually make the transition to this sustainable and desirable future is going to take a movement. It's going to take all of these pieces coming together. It's not going to be the individuals. It's not going to be just the communities. It's not going to be just government. It's going to have to be all of those things. And I think they have to be driven by an overarching vision of what this sustainable and desirable future or picture or society is that we're looking for. I think that was kind of what drove the reductions in inequality in the early part of the 20th century. The progressive movement, had a clear vision of what they were trying to produce in that society and began to implement different strategies to get there. And it was only after that vision changed to one that was completely individualistic and, the sort of Reagan, Thatcher, the market is everything vision, that it started going in the opposite direction. So I think it's time to change that back to a vision that involves trying to improve the well-being of not just individual people, but societies and the rest of nature, the whole system, and understanding that it is all an interconnected system that we have to worry about. So I think we're pretty much stopping on time, and thanks everyone for coming, and thanks for all of our panelists, and yeah, let's have a round of applause.
Thanks a lot.
Bye, guys.
Bye. Thank you.
Bye.